Okay, the doctor's ready, so we want to connect the A-line to the patient, and then we want to plug it in right here to this cord. So we'll make sure we get a line up there. The next thing we want to do is zero it out. But first we want to make sure that these connections are in neutral position, the off is facing outward on both. Once we do that, we want to point this off to the patient. I like to say zero down. You want that arrow facing down. We're going to take off the cap, and then we're going to come up here and we're going to hit zero. So we're going to get to zero. We're going to put the cap back on. We're going to go back to neutral, and we're going to hit and give it a little bit of a spike just so we can check our square wave there. So once that's going, if it was a live patient, we should be getting some type of blood pressure. So you also want to make sure you have your transducer taped. You use the nipple line. That's going to give you your fourth intercostal space. It's the phlebostatic access. You want your transducer there. You can tape it to the arm, especially if the person doesn't have the best body habitus. You just want to use that as your reference point to where you want your transducer. If respiratory, and only respiratory, really should be drawing blood from an A-line. If they asked you to, you can flush this and then replace it onto the cap, and then they can draw blood. And if you really had to draw blood, so we'll flush this. Once this is flushed, we'll place it on there. And now you want to point up. We're going to blood up, so the blood will come out. You put your syringe on there, you draw the blood. Once you're done, put it back to neutral. Never flush the line. You want to use your blue pigtail and flush it all the way through, and make sure the blood's totally cleared out of there, because if you have air bubbles or blood, it's going to give you a false reading. Remember to zero out your patient every time you move them back and forth to CAT scan. If there's been changes of position, if the reading looks different, if your wave looks different than it had been, a good point is to always zero it out. If you're having issues, check your connections, check your blood pressure bag, make sure you're where you're supposed to be, and like I said, make sure that there's no blood or bubbles. If worse comes to worse, you can check your CAT for blood too.